Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 578 of our pharmacotherapy series, which majors in geriatric drug use. The first case reads: TAH is a 72-year-old Hispanic woman who is currently wheelchair-bound because of pain in her right hip. Her granddaughter brings TAH to the geriatric clinic because she has recently developed urinary incontinence. Her granddaughter reports that TAH has been feeling weak for the past 2 days and fell while getting out of the wheelchair. A urinalysis indicates the presence of a urinary tract infection, abbreviated as UTI. My first question to you reads: are TAH's symptoms typical of urinary tract infections? Urinary tract infections are common in older patients, and clinical symptoms often vary from patient to patient. Common signs and symptoms may include dysuria, hematuria, urinary frequency, urinary incontinence, pyuria and fever. Bacteriuria is estimated to be asymptomatic in more than 15% of women over age 70 who live in the community, and even greater in men and women who reside in long-term care. Asymptomatic bacteriuria may not always require antibiotic treatment. Impaired voiding with residual urine in older women and obstructive uropathy from prostatic disease in older men predispose them to bacteriuria. The severity of urinary tract infection in the older population ranges from mild cystitis to life-threatening urosepsis. Both are more difficult to treat because of resistant organisms and age-related decreases in host defenses. The majority of urinary tract infections in the older population do not present typically. Instead, there are often nonspecific manifestations such as decline in functional status, cognitive impairment, weakness, falls, and urinary incontinence. TAH's presentation, weakness, urinary incontinence, and a recent fall, is consistent with this pattern. As with most urinary tract infections, those in the elderly are caused primarily by Escherichia coli. However, other species of bacteria such as Klebsiella species, Proteus species, and Enterococcus species are also frequently involved. TAH is prescribed a 7-day course of ciprofloxacin 250 mg orally twice daily. My next question to you reads: is this drug therapy appropriate? Oral antibiotics, such as nitrofurantoin and sulfamethoxazole trimethoprim, are appropriate for most patients with symptomatic urinary tract infection, reserving fluoroquinolones as alternatives. An important consideration of antibiotic therapy for older adults with urinary tract infection is impaired renal function. Nitrofurantoin should not be used in those patients with significantly impaired renal function due to the potential risk of peripheral neuropathy and pulmonary toxicity. Ciprofloxacin is a reasonable choice for TAH because Escherichia coli is the most likely causative agent. Fluoroquinolones carry a black box warning due to an increased risk of tendinitis and tendon rupture. Along with renal function, monitoring should include symptoms of tendon inflammation or pain. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom, and if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 579.